What is rheumatism? Signs, types, causes, and treatment of a disease. Interesting about science and medicine prepared by editors of a page All Scientific. Rheumatism is all groups of diseases from various categories that have the following common symptoms. Pain, chronic nature, interfere with normal function of a joint. Rheumatic diseases are divided into categories: arthritis, inflammatory disorders, arthrosis, chronic disease of a mechanical origin. Arthritis is characterized by pain at the joint level. Often this pain intensifies at night and decreases in the morning. The joint, often inflamed, regain their mobility after a certain period. In most severe cases, the affected joint becomes rigid and deformed completely. Analysis of a joint lubricating fluid, synovial fluid, allows us to confirm the inflammatory nature of a disease. Depending on the cause, KNOW or unknown, there may be different types of arthritis. The origin of aseptic arthritis, non-infection arthritis, is usually unknown. The most common of these is acute rheumatoid arthritis, which mainly affects the ankles, elbows, and knee. This disease is characterized by painful inflammation and the risk of cardiovascular complications. Rheumatoid polyarthritis, another type of aseptic arthritis, is characterized by inflammation of the ligament and the joint cavity, synovium, affecting several joints at the same time, especially in the area of the fingers and fists. The disease can cause disability. The evolution of the disease is slow, stretching over several years. Arthritis with microcrystals occur with microcrystals are present in the joint, causing inflammation. Depending on the nature of a microcrystal, arthritis may vary. The most common of these diseases are gout, which occur due to presence of uric acid crystals, chondrocalcinosis, which is caused by calcium pyrophosphate crystals. Still, diseases begin in young people under 16 years of age. This inflammatory disease has three forms: oligoarticular, 5 cases out of 10, which is characterized by damage of 4 or more joints without fever; polyarticular, 3 cases out of 10, which is observed most often in women and manifests itself as systemic and diffuse joint damage; systemic, 2 cases out of 10, which is observed most often in children under 5 years of age. Still, this is a very severe disease which is characterized by following symptoms: hypertrophy of the spleen, inflammation of the lymph nodes, fever, inflammation of the heart muscle sometimes. The cause of septic arthritis are microbes that enter the joint through the blood from another source of infection, or accidentally through an open wound or surgical intervention on the joint. Most often, septic arthritis is caused by common infection agents, Staphylococcus and Streptococcus. Treatment of these types of arthritis consists of taking antibiotics. Therapy begins before the infection agent is identified because microbes can cause irreversible damage to bone and cartilage in just a few days. Then treatment is adjusted with the identification of the exact causative agent of the disease. The following medications are most often used to reduce the pain of rheumatism as a result of arthritis: anti-inflammatory medication, analgesic. In the case of arthritis with microcrystal gout or calcicocalcinosis, rheumatism is treated with medication specific to each disease. In the treatment of arthritis, the rest is indicated in order to limit inflammation. If the joints are deformed, destroyed, or very painful, a prosthesis may be needed. Arthrosis compared to arthritis is not an inflammatory disease. Arthrosis is included in the list of degenerative disorders which are characterized by damage to articular cartilage and associated with the spread of underlying bone tissue. The following joints are most often affected: spine, neck, hips, legs, arms, knee. Arthrosis occurs more often in people over 60 years of age. The risk of a disease increases, especially if the joint loses its property, flexibility, elasticity, sliding. Women suffer from this type of rheumatism 3 times more often. The probability of damage in articular cartilage increases due to following factors: genetic predisposition to intense sport or professional activity, trauma sometimes. Pain is of a mechanical nature, occurs during activity and disappears during rest. During the first attack of arthrosis, radiography does not allow diagnosis of the disease. However, the examination allows you to exclude other diseases responsible for similar pain. X-ray allows you to measure the thickness of a cartilage and assess the rate of thinning during the disease. When arthrosis evolves, radiography can highlight the presence of bone growth along the contour of a joint surface, the cartilage of which is destroyed by arthrosis. If such bone growth occurs on the spine, they are called osteophytes. The following medications are used to reduce pain in case of arthrosis: corticosteroids, anti-inflammatory drugs, analgesics. During attack of arthrosis, it is important to rest the affected joint. Patients with arthrosis should avoid injury and stress, which can cause crisis of arthrosis. In case of obesity, a diet to get rid of extra pounds can improve symptoms associated with joints. Thermal treatment and physiotherapy can be very useful. As a last resort, when the joints are destroyed, surgery with the installation of a prosthesis can be used. Rheumatology is a science that studies diseases of bone and joints. These diseases are very similar to each other due to pain and ankylosis, which prevent the normal functioning of a muscular skeletal system. Rheumatology mainly studies skeletal disorders, Paget's disease, rickets, osteomalacia, osteoporosis, degenerative joint disorders, herniated disc, arthrosis, inflammatory disease, arthritis, and muscle disease, myositis, ruptures. Thank you for your attention. This material was prepared by editors of a page or scientific. Attention, this material is for informational purposes only. When observing various unusual symptoms, it is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.